You know, when you think about artificial intelligence, you think of pure logic, right? A world of ones and zeros, totally free from messy human prejudices. But what happens when that very tool, a tool that's designed for objectivity, starts showing the same biases we've been fighting for centuries, especially in a place as critical as healthcare? So how deep does this problem really run? Let's get into it.
Okay, just look at this. These are two AI-generated summaries from the exact same patient case notes. The only difference? The patient's gender was swapped. For Mr. Smith, the AI flags a complex medical history, but for Mrs. Smith, it says she's independent and able. How on earth is that possible? Well, that's the big question at the heart of what we're talking about today.
All right, so to figure out how a supposedly objective algorithm can get this so wrong, we have to look under the hood. We've got to see what it's actually learning from. So, researchers at the London School of Economics did pretty much exactly what we just saw. They took real anonymous social care notes and fed them into a bunch of different AI models, asking them to create summaries. Then, they ran the test again, but this time they just changed the gender pronouns. Simple as that.
And the results? Whoa, they were stark. For example, Google's Gemma model consistently downplayed women's health needs. For men, it was using words like disabled and complex. But for women with the exact same set of problems, it would either leave out their care needs or describe them as less serious, saying she was able to manage her daily activities. And think about what that means. Since care is based on this perceived need, this could literally lead to women receiving less care than men.
And listen, this isn't just a one-off glitch with one particular model. This is systemic. A U.S. study analyzed 133 different AI systems and found that a staggering 44% of them showed gender bias. So here's the real takeaway. The AI isn't inventing this prejudice. It's just holding up a mirror to the data we're feeding it.
And that data, the very information these AIs are learning from, well, it comes from a long, really complicated history. A history where, in medicine, women were, well, they were often basically invisible.
Yeah, this phenomenon actually has a name. It's called Yentl syndrome. Dr. Bernadine Healy coined it back in 1991, and it refers to this reality that for a woman to get the same level of medical care as a man, she might have to show up with the exact same symptoms as one, symptoms which might not be typical for her biology at all.
This goes way back. Up until the 1990s, women were actively excluded from most clinical trials. And why? Well, the concern was that their hormonal cycles would skew the data. Can you believe it? So the male body was just treated as the default human body, and this created a huge, dangerous knowledge gap. We all learned that a heart attack feels like crushing chest pain. That's the classic male symptom. But women's symptoms, like fatigue or jaw pain, were just dismissed as atypical. And the real-world consequences of this are just staggering. A government report found that between 1997 and 2000, 80%, that's 8 out of 10, of the prescription drugs pulled from the market were withdrawn because they were more dangerous for women. These were risks that might have been caught if the initial trials hadn't been so focused on.
The personal cost of all this is just profound. It leads to something that researchers call medical invalidation, which is an experience where a patient's very real, very painful symptoms get dismissed by the very people they've turned to for help.
Okay, let's just walk through what this actually feels like. So Sarah is in real distress, but her provider, Chad, he sees normal test results and just dismisses it as nothing major. When she pushes back, he suggests it's probably just period pain. She feels dismissed, he feels flustered. He ends up recommending diet and counseling, and she leaves thinking, great, another provider who thinks I'm crazy. That right there, that's the human consequence of a system built on biased data.
But here's the twist, and it's a big one. AI, the very tool that's reflecting all our historical biases back at us, might just be our best hope for finally fixing them. It really is a double-edged sword.
Now, to get how AI can be a solution, we have to wrap our heads around the idea that not all bias is bad. Undesirable bias is what we've been talking about, the AI learning from a flawed history and perpetuating inequality. But then there's desirable bias, and that's when an AI is smart enough to account for real biological differences to deliver better, more precise medicine, like, say, recommending a different drug dose for a woman because of differences in metabolism.
So that brings us to the most important question of all, right? Can we intentionally design AI not to be bias-free, but to be biased in the right way, to actually be a tool for equity and precision?
And the answer is yes, Absolutely. But, and this is a big but, it's not going to happen by accident. It requires a really deliberate blueprint for the future.
The good news is, the path forward isn't some big mystery. Researchers have laid out a pretty clear, three-step blueprint for building a more equitable AI. We need to demand fair data, build transparent systems, and promote diverse leadership.
First up, the foundation for everything, the data. And AI is kind of like a student, you know? It can only be as smart as its textbooks. If those textbooks are missing half the population, its knowledge is going to be dangerously incomplete. We have to consciously go back and close these historical data gaps.
And don't think this is just a problem from the past. New data gaps are opening up as we speak. I mean, look at this chart. In South Asia, women are 23% less likely to own a mobile phone than men. So what does that mean? As healthcare increasingly relies on data from our digital devices, this digital divide could create a whole new generation of biased AI, completely blind to the health realities of billions of women.
Second, we've got to open up the black box. Explainable AI, or XAI, are systems that are designed to show their work. So instead of just giving you an answer, they explain why they reached that conclusion. This transparency is so vital. It lets us audit the AI's logic, catch those undesirable biases, and actually build trust in its recommendations.
And finally, and honestly, this might be the most important piece of the puzzle, it's about the people. Technology doesn't develop in a vacuum. Studies have shown over and over that when women are in leadership roles on research teams, those teams are far more likely to analyze data based on sex and gender. Diverse leadership just asks different questions and looks for different answers. It's that simple.
So in the end, we're at this incredible crossroads. AI is going to learn whatever we decide to teach it. The choice is really ours. Are we going to build systems that just amplify the mistakes of our past? Or are we going to design them to reflect our highest aspirations for a more equitable future? That's the challenge and the incredible opportunity that lies right in front of us.